Hi, I'm Stefan, the CEO of ABC Medical Center. I wanted to take a few minutes of your precious time to explain to you our new system for medical records. Our new EHR system will be rolling out within the next couple weeks, and it's going to be including stuff like our My Charts and some of our social media outreach systems. Some of you are going to be asked to make small videos like I'm doing, to where you'll be able to do smoking cessation, the components of our medications, and just simple outreach that each one of you will be able to do with different patients. So, starting off on the front end, this should be able to take down some of our charting time to where we can spend more time with our patients versus all that time we're wasting redundant charting. On the second hand, it'll also give our patients access to their medical charts in a faster and easier to understand way. And then for our actual physicians, as well as our nurse practitioners, they'll be able to see our charting live time from at home, as well as from their cell phones, their tablets, wherever they may take a second to want to get caught up on that patient. And then with the mHealth technologies, such as our mobile apps that will be rolling out and everything, you'll actually be able to constantly be able to update our patients as well as chart on our patients as we go. So, as we get rolling this system out, a nurse from orthopedics will be able to do a one-to-one with their patient, where instead of spending 5 to 10 minutes with their patient, they'll actually be able to spend that full 30 minutes with the patient, be able to sit down, feel like they're getting that connectivity with that patient, and then spend 5 minutes afterwards charting about that interaction. So it should help speed up the process of us feeling like we're having that one-on-one with our patients. For our physicians, they'll be able to spend more time interacting with their patients and less time charting on their patients. And then when we start rolling out our social media broadcasts, we'll actually be asking some of you to go ahead and do the recordings. So I may ask an RT on our end to start talking about smoking cessation and being compliant with it. And then start rolling out some more of our education pieces to where these patients can actually jump online and get a nice one-on-one class or a group class to where they feel that they're more involved with that medical decision making. The idea with the new system is it will allow us to start looking at the physician quality reporting initiatives, the PQRIs, from the financial and non-financial merits of our system. So what does that mean, Stefan? Well, all that means is that we'll be able to see our critical information across all providers within our system. So when our simple as a certified nurse assistant putting in the heart rate, all the way to our physicians putting in a after actions review, everybody will be able to see that. Everybody within our systems will be able to read on it and start putting in their compliance issues. And then from there, we'll actually start seeing at the administration level what is going on with these patients as a whole, as well as the outcome for each individual patient. The new system will also make it easier for us to be able to tell our patients all about the side effects of any treatment, as well as what side effects medication will have. It'll also give us the ability to print out those side effects for our patients because everybody's different. Some people want to learn from seeing, some people want to learn from reading, some people want a combination of both, and this will give us that ability. Now, with this new system comes greater communication and connectivity, where our old system we were seeing those issues. With our new system, it'll be a lot easier for us to start seeing and print out our patient records. With this system, we'll actually start seeing clinical guidelines pop up, as well as our nurses and our doctors will be able to customize the alerts and reminders for our other care providers and patients, as well as clinical guidelines that'll be very specific to the order sets that our physicians are doing. Some of these will also allow for the paper-based charting to go away completely, and the goal of specific treatments to be monitored and for electronic writing to be a full range of orders, maintaining an online medication administration record, and review changes of orders by successful personnel, as well as gives us a safety alert and safety systems for anything that may be considered an unsafe order, a duplicate drug therapy is ordered, or a clinical decision support system to give guidance to our caregivers in less expensive alternatives, or to give us better fit to establish our hospital protocols. Now, as this rolls out, I would like to get your guys' feedback, as well as see more and more videos as we go. So, as always, if you see me in the hallway, you want to drop by, give me a quick buzz and let me know how it's always going. My door's always open, and I look forward to working with you and our teams as we get going down this new field with our new EHR system.